Welcome to America's Heroes Group.
Good afternoon, and welcome to America's Heroes Group Roundtable with partner Veteran Healthcare Policy Institute. April is Sexual Assault and Autism Awareness Month. It's Saturday, April 30th, 2022. I am co-founder, Vietnam veteran, and host Cliff Kelley.
Yes, the iconic Cliff Kelley.
Thank
and I am his co-host, Colonel Dr. Damon Arnold. Our executive producer is Glenda Smith, and our digital media producer is the impeccable Ivan Ortega of Scouts Honor Productions. And we have Jada in the booth helping us out, doing a good job. And today we have a partner with us, Suzanne Gordon of VHPI, the veterans partner that is really making a difference in what we're doing. So the Veteran Healthcare Policy Institute is doing work every day on our behalf. So the VHPI Senior Policy Analyst, and her work expands over decades, reporting on healthcare programs, workers, policy, and she has edited and authored 21 books. But Suzanne has written 2 books, and they are entitled The Battle for Veterans Healthcare and Wounds of War. Make sure you pick these books up and read them. They are excellent. They give you a great outline of what is going on in this arena. Our discussion today will be a continuation, part 2, Air Commission. So I am so happy to have you here, Suzanne. I know we always run out of time when we talk to you. So how are you doing today?
Thank you so much for having me. Thank you.
Great. So tell us about this.
Well, we began the conversation last week, and this is a booby trap that was set for the VA, a whole bunch of booby traps, ambushes, whatever. I wasn't in the military, so I don't know the lingo here, but basically the Trump administration, whose goal was to privatize the VA entirely, essentially created this thing called the VA Mission Act of 2018, and it radically accelerated the outsourcing of veteran care to the private sector, which is a really not very good idea, because private sector providers, doctors, et cetera, don't really know a lot about veterans, who represent a very small portion. Veterans, about 6% of the American population, and VA patients about 3% of the American patient population. And in the Mission Act contains something called the Asset and Infrastructure Review Commission, which is like the base closing, like the DOD's base closing commission, where basically the VA secretary, who Trump hoped would be a Trump VA secretary committed to the program of dismantling the VA, would collect data on VA patients and capacity, and also private sector capacity, and recommend modernizing, realigning, closing. Modernizing really in this world is a word for closing or messing up, and they would make recommendations about facility changes, transformations, closures, and then the president would accept them or not and send them to Congress, where they would be voted on in an up or down votes. So nobody could say, wait a minute, you're doing this to Jesse Brown, we don't like that. You have to vote up or down for the whole list. Mm-hmm. And the secretary Trump hired consultants to conduct the market assessments, and the consultants, we don't really know whether they were guided to do this or directed to do this, or whether they were just incompetent. I mean, I think something like over $100 million was spent on this process, which has produced, according to many critics and also the Government Accountability Office, very flawed recommendations. The data was so flawed that really it's useless. But nonetheless, rather than saying that and showing real leadership, Secretary Dennis McDonough, VA Secretary, went ahead and made a bunch of recommendations which would outsource huge amounts of veteran care to the private sector, close at least 60 hospitals, many of them in rural areas. There's a promise that he's going to rebuild a lot of super community clinics, but it would require an allocation of over $220 billion from Congress. And at the rate that Congress allocates money to VA infrastructure improvement, that would take, let's see, they need $220 million, and Congress allocates about $220 billion, and Congress allocates about $3 billion a year. Do the math. How many years would that take?
Right.
I'm not good at math. You are,
Yeah, but one thing too, you bring up a good point, because one of the questions I have is that, if we look at, the congressional body itself, there are two kind of points I want to make, and I'm going to ask you about it, is that, they're sort of exempted from insider trading, right? They're exempted from a lot of things that are going on the financial market. They're getting funding for their campaigns from contributors from private sector. So I'm not sure if there's an ethical component here of whether they're pushing money into a private sector that's supporting them personally. And then
Go ahead. And the second?
Oh, and the second is, is this going to cost more by going to the private sector? Because I thought the reason why we had a VA was to save money for the taxpayers.
Yeah, these are such great questions. And the first question is, yes, since 2014 and since the privatization of the VA and the healthcare industry, the pharmaceutical industry got that, and then not only the healthcare industry, like hospitals like Rush or the Cleveland Clinic or whatever, but also just mom and pop claims adjusters, who want to bilk veterans of money to process their claims, which Jasper Craven's been doing a lot of work on this and should probably be the subject of another show. But, there's all kinds of little groups that, would like to teach veterans to play golf or take them horseback riding or on wilderness treks. And they see, dollar signs in the privatization of the VA. So you have all kinds of people from the biggest healthcare corporations and private equity firms, which now run a lot of healthcare, to these kind of mom and pop people that are calling their congressman and saying, but if we take, Joe Smith on a wilderness outing, his PTSD will go away in 10 minutes, which actually the studies don't show.
No.
And so we've seen a huge amount of increase in the funneling of campaign contributions to members of the House and Senate Veterans Affairs Committee, who usually really didn't, these committees were actually not very sought after assignments because you couldn't get money because nobody was interested because it was all the public funds. And now they realize, whoops, we can get money, we can get our hands on 90, part of this 90 billion, 100 billion, 200, whatever it is. And so, yes, that's an answer to your first question. So these people who are, we're supposed to be doing the bidding of veterans and taking care of veterans are really taking care of their own careers increasingly. And, Joe Manchin is a huge recipient of money. A lot of these folks are. And it's, I think John Tester has a lot of hospital industry campaign money. He's the chair of the Senate Veterans Affairs Committee and so forth.
So this is bipartisan gouging.
Exactly, bipartisan gouging. And oh my God, I forgot what the second question was. What was
the second one was actually about the the financial. We're losing money and that kind of thing. You really answered.
Yes. I'm so glad. Okay.
Yes.
So essentially, what's happening is we're losing money in two interesting ways. The first and very obvious way is that more and more of the veteran healthcare, clinical care budget it's now up to 20%. It's increased between 350 and 500% in the last 3 years. It's now going to private sector profiteering.
Wow.
And we know that, it's way more expensive to take care of people in a fee-for-service system than it is when people are on salary, and every little, test isn't a ka-ching, 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 And so, and there's basically, most people in America are, when they're insured or they're in a health system like Kaiser, there's a lot of utilization review. And so there's, many physicians and nurses and people feel quite irritated by this. But, and there's a lot of care denial, but there's there's utilization review, so you can't just go wherever you want to get care at whatever cost you want, whatever time you want, for however many sessions you want. There's review of this. In the VA, there's essentially no utilization review. There's a lot of scandalous billing practices on the part of the private sector, which upcodes all the time to make it seem like they're doing things that are worth more money when they're not doing anything at all. A classic. I mean, I remember one time meeting a doctor in the hall of a hospital where I was going for something else, and I stopped to chat with him, and he asked how I was, and I said fine, and I got billed for that.
Oh,
I
you're
mean,
kidding.
literally.
Oh my God.
No, I am not kidding. Could I invent something like this? No.
Oh my goodness.
I mean, it's like your lawyer. I once had a lawyer who, lawyers, they start the clock. There's some computer program. The minute you say hello, it starts the clock. And I remember one time my lawyer billed me for something wrong, and I told him, and he said, call so-and-so or do something. And they charged me for the call about the wrong billing, and then I had to call about that. I mean, but it's all about billable hours, right? And so obviously you have a huge amount of money going to an uncontrolled, unaccountable private sector doing anything they want, recommending, all kinds of things that may not be necessary, or, every test under the sun. And that costs more. In the VA, if you have shoulder surgery and you need a pulmonary or a cardiac clearance, Damon, you can perhaps explain this to the listeners. I mean, in the VA, your primary care doc does that, and it's not each thing isn't a separate charge. In the private sector,
that's right.
It's a separate charge. And so
that's right.
The cash register is ringing
every time they send you to a referral.
Yeah, and so obviously it's clear why it's cannibalizing more and more of the VA budget. But the other way it's cannibalizing the VA budget, which is really interesting, is that veterans have been told that they can have a choice, that they can kind of have their cake and eat it, that they can have their network, their VA healthcare system, whenever they want, if they are eligible. And they can also go anywhere they want, whenever they want, and the VA system won't be compromised. Well, what's happening is if you maintain the buildings and your fixed costs, the heat, the electricity, the pipes, the water, the maintenance, and also the labor costs, so you're maintaining this system, this comprehensive system to serve veterans, so it's there when they want it, and then you're allowing them to not use it, right? So, your surgeon is still being paid. Your mental health professional is still being paid. Your primary care doc is still being paid, even though you're not going to him or her, because you're going out into the community, into the private sector. So what is happening is the cost per patient of care at the VA is going up because people are paying for it twice.
Yes. See, and you may be repeating unnecessary tests and.
Well, not to mention that, but you can't. There's no healthcare system in the world, not just in America, that allows you to go out of network whenever you want. Kaiser doesn't pay, Kaiser's the most comparable system to the VA. Kaiser doesn't pay for you to go to UCSF or Sutter or Pacific, CPM, California Pacific Medical Center. If you're a Kaiser enrollee, you go to Kaiser. If you cannot get something at Kaiser, some incredibly fancy schmancy thing, then maybe they'll pay for you to go out of network. But if you want to go out of network to get a second opinion, if you want to go out of network because it's more convenient or whatever, you have to pay out of pocket. Same is true if you're in a preferred provider organization. Yeah. You want to see a doc or a PT or whatever who isn't in that network, you have to pay out of pocket. Well, vets want something that nobody else can have, and the reason why nobody else can have it is because it's not sustainable. Mm-hmm. And basically that's what's happening with the VA, and so we're seeing the cost per patient of VA care go up because the same labor costs and fixed costs are being divided by a smaller number of patients.
Well,
and eventually Congress is going to say, excuse me, guys and women and whatever, we're not doing this anymore. We can't afford this.
Maybe you're answering my question before I ask it, because that's what I was getting around to, Suzanne. Yeah, what do we do? Obviously, there's a problem here. What needs to be done to correct it?
Well, I think the Secretary needs to hear from every veteran in America, and I think the Secretary needs to be shamed, and he needs to be saying, why are you killing the VA healthcare system? Why are you advocating the destruction of 60 VA hospitals and medical centers? Why are you closing rural hospitals and adding to the rural healthcare crisis? Why are you closing down a system that delivers more health equity to African American veterans and veterans people of color? Why are you dismantling a women's health system that was built over decades to serve women veterans? Shame on you.
Yeah, because Suzanne, it's another correlate to that, and we've spoken about this before on shows, is the idea that if you close down the VA system, you also have the disconnection with disability claims, with the for veteran service organizations, the VSOs, and also you have veterans homes where people are living where they would otherwise be homeless.
Oh yeah, you're going to send them into these unscrupulous, system of substance abuse clinics that are horrible and homeless, SROs, single residency occupancy hotels that are poorly run, and this is going to have a huge impact on minority veterans, because minority veterans or veterans who are people of color represent about 21% of VA patients. So VA patients represent about 3% of the patient population.
Yeah.
So 21% of VA patients are people of color, which means 0.57% of the American patient population. The VA bends over backwards. Maybe it hasn't done enough, but it bends over backwards to help people of color, African American veterans. Do you think that other healthcare systems where veterans of color are 0.5% of their patients are going to care about 0.5% of their patients?
Right. That's
0.5, not 5. Point.
Yeah.
And women veterans, women veterans are 7% of the VA patient population. For 7% of the VA patient population, they have constructed an entire separate healthcare system. Women veterans out there in the regular world will represent about 0.19% of patients.
Yeah, Suzanne, we always have this incredible discussion, and we're out of time now. But I love talking to you because you always make me think about 50 more questions, which is a good thing, which is a great thing.
Yeah, she does.
And
You're right.
so America's Heroes Group Roundtable with partner VHPI, Veteran Health Care Policy Institute. You are on the case. You're making the case for veterans to get engaged, get in contact with the Secretary of the VA system, and also your congressional members to make sure they're supporting you and your families. Thank you, Suzanne, again, and we're going to be moving on to a commercial break. I want everyone to stay here. We have an exciting show coming up, and stay with us. AHG will be back in a moment.